is BBC Radio 5 Live. Available on the BBC Sounds app. 5 Live Drive with Sarah Brett and Tony Livesey.
And a very good afternoon to you. The number of coronavirus cases in the UK has increased by 34 in a day, meaning there are now 85 infected patients. Public health officials say they're trying to work out how 3 of the new cases involved people who'd contracted the virus in the UK. England's Chief Medical Officer, Professor Chris Whitty, says a coronavirus epidemic is now likely in the UK.
If it's a relatively small wave, then it might feel rather like a bad winter in the NHS, but in summer or late spring. If it gets a much larger wave, then the first thing we would do would obviously be to cancel those things that can be delayed and push them out in time to a later point when it's safer to do them. And then if it gets to a very large wave, then we would need to reconfigure the NHS in a much more fundamental way.
So undoubtedly we'll be asking now how prepared the NHS is to deal with coronavirus, and we'll be speaking to lots of different people over the coming days about that. If you've got a view on it, if you work in healthcare, we'd love to hear from you. 85058 and at BBC 5 Live. Dr. Samantha Batt-Rawden is with us, who's co-founder of the Doctors Association UK and is a doctor working in intensive care. Thanks very much for being with us, Samantha.
Oh, thank you for having me.
The organisation you belong to has done a survey looking at how prepared the NHS is. What did you find?
So the Doctors Association UK has been hearing from frontline doctors for a couple of weeks now that they're getting really, really worried about the lack of information coming from the government. In particular, the party line that we've heard again and again, the NHS is well prepared for coronavirus. I think doctors have tried to escalate their concerns on the front line, but haven't got very far. So we ran this survey and we didn't quite expect to get as many responses as we did, but we heard back from 1,600 doctors and only 8 of them said they thought the NHS was well prepared. I must stress this was on Sunday, so before the most recent announcement from the government, and actually I think now the government's responded. Now we're seeing them be a bit more honest and putting those plans in place with the coronavirus action plan. So I think we're much more reassured certainly than we were last week.
8 out of 1,600?
Yes.
That's
yeah.
staggering. How many of them were GPs roughly?
We think about approximately half, so approximately 800 of them were frontline GPs.
What were the concerns that they gave you, from the GPs to people in A&E, etc.? What were they talking about?
So multiple concerns. I think the first thing has been about the honesty of the government. Quite clearly coronavirus is coming, it already has. Quite clearly it's going to spread, and quite clearly we're going to need a lot more resources than we do now. And it was just felt that no one was being honest about that. So I think that was the main concern. Concerns particularly from GPs. They're already a service under incredible pressure. They don't have enough staff at all. Patients are already waiting 3 weeks to get an appointment, and that's not the fault of GPs. It's just a service under so much pressure already. How are they going to cope with a surge of patients? And I think the third thing, and the most worrying thing probably, is the fact that GPs as frontline doctors haven't been provided with any personal protective equipment or PPE, despite seeing cases of suspected coronavirus coming into the surgery. To me, that's absolutely bonkers.
Do you think the message is getting through to patients, Samantha, that they should not go to their GPs if they think they've got symptoms of coronavirus, that they should ring 111 and stay at home?
I think the messages are getting through. I don't think we can blame the public for this. Some of the messaging has been a bit confusing in the last couple of weeks, and now we're seeing it be more streamlined. The government's about to start a public campaigning on how we as a society can protect each other and ourselves from coronavirus. And I think that will go a long way into helping people know what to do. But the advice is certainly, please, if you think that you're suffering with coronavirus symptoms or you're coming back from a high-risk area, please don't go to your GP surgery, because that might mean they have to shut, and that's cutting down services for thousands of people. Please don't go through to A&E. The exception is if you're in Scotland, in which case, yes, ring your GP first, but everywhere else in the UK, ring 111.
OK, and just briefly and finally, when it comes to, we've been hearing from hospitals having specific coronavirus wards and all acute beds being set aside in the event of an epidemic, etc. What do you expect to see for people in a hospital setting? How will their care be different from anything they've ever experienced in hospital before?
So I think, if I may, I think that probably the first thing to say is absolutely don't panic. The amount of people, patients that are potentially going to need hospital admission or indeed critical care is very, very small. We know that in 80% of coronaviruses, the symptoms are self-limiting and very mild, just 5% of people being suffering with those critical symptoms. And those people tend to be in those high-risk groups, so elderly people who are already suffering with chronic health problems or respiratory disease. Having said that, there is concern amongst the intensive care community about how we are going to accommodate an influx of critical care patients. At the moment, we know that a lot of our intensive care units are running at full capacity and have been all winter. Doctors have been shouting this from the rooftops. We're already struggling as an NHS. We're already struggling with our critical care capacity. And therefore, I think we need to see some honest discussions from the government about how on earth we're going to increase that capacity when we just don't have those enough highly skilled intensive care staff to deal with an influx of patients.
Yes, indeed. We're going to need more doctors and nurses probably. Samantha, thank you very much. Good talking to you.